Laryngitis can best be described as an inflammation of the larynx, and symptoms can range from severe hoarseness to no voice at all. According to Dr. Michael Gatto at Desert Regional Medical Center in Palm Springs, laryngitis is caused by many different conditions.
Laryngitis is really the inability to speak on an acute, usually an acute basis, so difficulty in transferring your voice. And it could be from a number of reasons. One could just be an acute infection, usually a viral infection. It could be a chronic issue, for instance, voice misuse, and people misuse their voice. Mostly people that tend to have to use their voice a lot. So teachers, lecturers, attorneys, various people in show business, announcers, that tend to maybe misuse their voice for variant amounts of reasons will cause the chronic laryngitis. But then again, there are issues that can actually cause a malfunction of the vocal cords, such as lesions on the cord, cancer. There are reflux is a big issue. It's called laryngeal-pharyngeal reflux rather than gastroesophageal. It's the same mechanism of action. It's still production of acid in the stomach that's produced and winds up in the esophagus. However, in our field, it is really throat problems more than gastric problems.
And what should you do if you get laryngitis?
Well, you need to go to an otolaryngologist, someone that's capable of looking into the pharynx and looking at the larynx, and we're the specialists that do that. And you'd come in the office and we spray an anesthesia in the nose, and we put a flexible scope in the nose and behind the nose and visualize the vocal cords, and that will make a diagnosis. For the most part, it depends on the appearances of the vocal cords and how long the symptoms have been there, and what else does the patient do, what's their occupation, do they smoke, do they have reflux, and it is treatable with newer medications. It's usually short term. The only danger in that is people trying to talk while their vocal cords are possibly swollen or irritated, and then you try to force voice out, and that can cause some damage to the vocal cords by doing that. So for the most part, when you have laryngitis, you want a voice rest. Fluids, hydration, voice rest, and sometimes oral steroids or inhaled steroids can take down that swelling. It's usually short term. I think if you're really having difficulty speaking for more than a week, you need to see someone. At that point, you need to take a medication that will take down any kind of residual swelling of the vocal cords.